Hey friends, this is Ian Khan here at HIMSS 25. I have with me somebody who can share the European side of healthcare and what's happening. I have with me Guido, who is Chief Data Officer at St. James Hospital in Ireland. And I love Ireland, and I've always wanted to go there. So one of these days, I'm definitely going to make it to Ireland, my friend.
You should definitely.
Guido, welcome to
Thanks so
the Futurist at HIMSS. We've had so many conversations here about healthcare, the future, technology, AI, regulations, funding. Everything's been in kind of the conversation. I want to ask you about Europe, right?
Yep.
I want to ask about you from a European perspective, the Irish perspective, and help understand what is happening on the other side of the ocean that is similar or different from what is happening here. The first one being, tell us about yourself. What do you do, and what are you managing and handling where?
For sure. So, bit of myself. I'm a medical doctor. I am the CDO of St. James Hospital. I've been working on digital health for about 15 years in different roles, positions, some academic, some startup, stuff like that. But currently as the CDO, I'm also have a position in Trinity College Dublin and in the University of Oulu in Finland, which is even further in Europe. So basically, a lot of the things that I do right now as a CDO is I'm in charge of trying to create a data-driven culture in the organization, in the healthcare system.
Yeah.
I don't know how much you know about the problems that people have in healthcare, but not a lot of doctors, not a lot of clinicians, nurses, physios know much about digital skills.
Yeah.
And that's a big challenge. So one of my roles is to try to figure out how can we make it so that all of this data that we gather actually makes sense for us who are clinicians,
of course,
and make an insightful decision for that.
You asked me a question, so here's what I see happening. I see a majority, not all, but a majority of doctors who are practicing doctors, they're just too busy with their practice, too busy with doing what they do, whether it's a specialist or a general practitioner. I see them busy in their own things, and they don't have much time, I guess, or incentive to look into, hey, how's technology powering the future, and what will AI do tomorrow? Like, I feel doctors are overworked. They are overburdened with patients and cases and their work, so they don't get time to do that. Yes, a very small fraction of them are curious. They have, gotten into different roles, like you are in a very different role, and they have the opportunity of kind of going to places, talking to different people, and working on these futuristic challenges that they're not aware of. So I'm with you. I think you're doing the right, very much work that is needed right now. Go ahead.
No, but I think that you're on the right track there, but it makes a lot of sense that would be the case, because think of it like this. If you went to medical school, you went to nursing school, you went to physio, whatever, you wanted to be doing things with the patients. You want to be working on that. And if you train to become a pediatrician, you want to become the best pediatrician you can possibly be.
Absolutely.
So the way that professionals look at it has a lot to do with like, well, I want to know how do I do the best care. Digital is kind of like a side thing that maybe I can play around with that. Yeah. And that's a major issue.
Yeah. And one of the things that I'm trying to think, because you're also an academic now, you're teaching, you're doing multiple things, which is amazing. So I'm sure you will get the point. The problem also is, so low number of doctors right now, who knows what's happening in the future. They need to get into technology fueled skills and understanding this era of AI, data, how things work. Otherwise, it's going to be hard. Many of them will retire in the next 5, 10, 15, 20 years. And there's very low number of, let's say, new doctors that the systems will create, because it's not a huge volume of doctors that's coming down the pipeline. And so the question is, how will that all work? Will the future doctors be with no idea of how data is powering their work, or what? How are you seeing this? Because you're in the middle of it all. What are you seeing?
I think that's a fascinating challenge. I'm actually involved in a large European funding project. It's called SUSA. It's Sustainable Healthcare for a Data Future. And it's basically, it's a European funded project that the EU invested 12 million euros for upskilling healthcare professionals. Okay. And the idea is not only just for healthcare professionals, it's about for people who are working with health-related data. So like if you have a software developer, if you have engineers, if you're going to be doing something in the health space, you need to have these skills. And it's really fascinating because, for example, I think that what we need to do is we need to come up with a sort of a tiered approach and a targeted approach for the healthcare professionals. So you need to have something that targets you when you're in the undergrad, something that is for you when you're a postgrad, something when you're a career professional. So for example, with Trinity College and as funded in the SUSA project, we are actually launching now a series of CPDs. Well, we call them CPDs, but are the CMEs, the credits that you need for professionals. So one of the things that we have is this specific CPDs, which are for generative AI essentials in healthcare. So the idea is that you're going to be trained on Gen AI if you're already a professional. We're creating a whole list of programs as a part of this initiative for bachelors, all of that, because we know that this is a current problem. We need to change the thinking, and the only way of doing that is by actually exposing you to more of these things.
Yes.
And that's a challenge.
Yeah, exactly.
But the good thing is that there is the will to actually go in that direction.
Of course. I think incentivizing learning is very important. And there has to be an incentive for everybody in it, the educational institutions that are creating the curriculum, the coursework, and I have multiple people in the healthcare industry in my family, my brothers, nieces, nephews, cousins. I have a lot of doctors in healthcare, so I know exactly what they've gone through their education. I have a nephew. He's in England. He's studying his medicine. My niece did her dental in Ireland, so I am aware of what they went through. So that incentivization has to be there for institutions like Trinity College. Should have an incentive for adding something in the curriculum, which they're doing, right? Whatever the reason is. Students and new doctors, they should have an incentive to learn stuff so that they know it'll help them, rather than, hey, it's another part of the curriculum and I don't want to read it. Oh my God, but I still have to do it. So I think there's a change that's needed in the foundational model of education rather than, just at the hospital level.
And it's funny that you say that, because one of the things that I'm working on, that we worked as part of this initiative, we actually, with Trinity College, we've done a series of future scenarios. Are you familiar with scenario analysis, future scenarios?
Yes.
So we actually done through participatory design workshops with students, healthcare professionals, senior academics, people from the ministry. We actually had these sessions where we I facilitated the session where we created these scenarios of like a post-apocalyptic future, one where we have the utopia and all of these things. And together with them, we created these sessions in which we were thinking, okay, if this is scenario one, what are the skills that we need to do to prepare for that scenario? Scenario two, what are the skills that we need to do that? And from all of that, we actually, using and involving the students, the health professionals, and that, we actually came up with kind of like a strategy guide. Okay, this is how we're doing the curricular redesign for the medical school.
Very nice.
Because otherwise, you need to be. I feel that one of the things that we're doing in healthcare is we're playing catch up all the time.
Oh God, yes.
And we need to be, okay, let's be more forward thinking. Let's look. These are the potential futures. Let's prepare for those. Sure, we're not going to be able to predict 100%, but we're going to be in the same direction. We're going to be in the right direction. We need to prepare for that. I think that if this exercise that we're doing now, we would have done it 10 years ago, 20 years ago, we would have been more ready for the pandemic. And for the whole transformation that is happening now.
I think, to summarize our conversation, I think the time to do something, to act is right now. Just do it, right? Don't even think about, 2 years from now, 3 years from now, because things are moving fast. And there's lots of different things that are impacting decision making, whether it's political, whether it's regional, whether it's global, whether it's a war, whether it's a pandemic, and these things are increasing day by day. There's many other things happening. It's not just war. It's not just a pandemic, but other socioeconomic things are changing.
And it's not just the climate; it's a combination.
Yeah, it's a combination of 100 different things. I don't know, 1,000 different things. So I think acting now is very important, and working on these foundations, as you mentioned, and what you're doing right now is incredible. So thank you for doing that and telling us all about what you guys are focused at in Europe, in the in small pockets of where you are at. So thank you for joining us here at HIMSS.
Thank you for having me.
I appreciate it. Thank you, my friend.
Thank you.
Thanks, Guido. Okay, good.